It's a matter of life and sex. Tech.
I was raised believing and living a powerful truth. My health is my wealth. By the time you hear this, I am hesitant to say, post-coronavirus, we are living in a world where. So instead, let me share with you a snapshot of our world today, where global threat to humanity has blown up the sexual health and technology industry. COVID-19 has unshackled ironclad taboos, but it's also exposed our industry as a positive impact on preventable healthcare. It is not safe to move, to play, to travel, to kiss, or to even make love without precaution. So hopefully this won't surprise anyone when I tell you that sexual health is no longer just a medical conversation. COVID-19 has forced us to think about our healthcare as preventable and not just reactive. Today, I want to talk to you about patient proposition versus private proposition. But before I get into that too deeply, let me try and deconstruct what that really means. I recently read an article about the participatory economy, whereby consumers demand that we shift the way we engage with them, from transactional to listening to their human-driven needs. So when I say patient proposition, I mean the old transactional way. And when I say private, I mean responding to the human needs of the consumer. Historically, sexual health has been categorically excluded from our health priorities. In fact, for the past decade, I've had a magic trick where I could empty out a boardroom in 30 seconds simply by saying the words safe, sex, condoms. Sexual health innovation hasn't been a priority for the medical profession. So there needs to be a shift, a balance of power that needs to be understood in order to transition from the patient to the private proposition. Let's take sexually transmitted infection. Our industry's black sheep. STIs are considered a disease and treated accordingly. Now with COVID, sexual health and technology is forcing behavioral change. Imagine a world where your STI testing kit lands at your doorstep. Your samples are safely and securely sent to the lab, and your results available at your fingertips. And now imagine a world, a digital world, where you can share that health status. Test, verify, share. Imagine a digital world where you can declare yourself free from COVID. Free to play, free to move, free to kiss, free to make love. It is here. The sharing revolution is here. It's time to break out of the medical chamber when it comes to conversations around sexual health. Our industry needs consumer-focused communication to intersect at the points of our actual human lifestyle needs. For this to happen, innovation does not stop in the lab. The power play is to transform your patient proposition and create a private proposition that responds and follows the road to behavioral change. So I can buy my STI kit when I buy my beauty box online. Meeting contemporary people's needs means placement in mainstream channels. The more we do this, so the narrative around sexual health becomes normalized, and we shift behaviors towards a healthy sexuality. When you look at the future of your sales in sexual health, it will lie beyond your existing tunnel vision approach. Because we know that when a patient proposition adapts for the participatory economy, they become the brand engines for change. They boldly redefine the lexicon that consensualizes that sex is something to be explored, that preventable healthcare is sexy healthcare. This is how to harness the roadmap from lab to unlocking the consumer lifestyle journey. That is the key. And this is really a matter of life and sex tech.